When you consume a heavy, carbohydrate-rich meal, your digestive system rapidly breaks that food down into its simplest form, glucose. That glucose floods directly into your circulatory system. Within minutes of finishing a plate of pasta or a large dessert, the concentration of sugar in your blood begins a steep, aggressive climb. To manage this sudden influx, a healthy body releases insulin. This hormone binds to specific receptors on the surface of your muscle cells, triggering an internal signal that tells the cell to bring glucose transporters to the membrane. In conditions like type 2 diabetes, this signaling pathway fails. Even when insulin is present and binds to the receptor, the internal machinery of the cell does not respond, leaving the glucose transporters inactive. Because the cell remains closed to the sugar, the glucose remains trapped in the vasculature. This turns a routine digestive process into a prolonged systemic crisis as blood sugar levels remain dangerously elevated. Despite this systemic endocrine failure, a 15-minute physical intervention can force the trapped sugar out of the blood and into the muscles. This chart tracks post-meal blood glucose. For a patient sitting on the couch, the graph follows a steep upward curve, a sustained spike. But followed by a 15-minute walk, a second blunted curve emerges, diverging sharply from the spike. To understand how a brief walk flattens this curve, we have to examine the cellular mechanics of both timelines side by side. We are tracking a pathway called non-insulin-mediated glucose uptake, a mechanical override switch built directly into the skeletal muscles. In the sedentary timeline, glucose steadily accumulates in the systemic circulation immediately after the meal. Without cellular clearance, blood becomes thick and viscous. This increases fluid resistance, forcing the heart to work harder to move syrupy blood through the vessels. At the muscle cell, the internal signal to transport glucose fails to trigger. The cell membrane remains a barrier, effectively shutting out the fuel circulating just outside it. This state is known as hyperviscosity. High-density glucose molecules cluster together, slowing the flow of blood and increasing the friction exerted against the arterial walls. This friction creates mechanical strain on the endothelial lining. The high sugar concentration drives oxidative stress, leading to a cascade of cellular inflammation within the vessel. By remaining sedentary, the patient allows a signaling failure to escalate into a physical, structural threat to the vascular system. Reset the timeline. This time, the patient begins a mild 15-minute walk immediately after the meal. We shift focus to the kinetics of skeletal muscle. Rhythmic contraction of the quadriceps and calves initiates a biological process that doesn't rely on hormones. Inside these muscle cells, transport proteins called GLUT4 sit dormant. These proteins are the pathways through which glucose enters the cell. While insulin resistance blocks the chemical signal to move these proteins, the mechanical act of muscle contraction operates on an independent pathway. As the muscle contracts, mechanical stress triggers GLUT4 vesicles to rise and embed directly into the membrane. These new channels allow glucose to rush from the blood into the working muscle. The cell now pulls sugar at an accelerated rate. This mechanical movement allows the muscle to absorb sugar directly from the blood, proving that physical activity can bypass a non-responsive insulin signal. As the walk clears glucose from the blood, it simultaneously improves the physical environment of the arteries. The increased blood flow from the walk creates mechanical shear stress, a specific type of friction, against the inner lining of the arteries. Endothelial cells respond to this friction by producing and releasing nitric oxide into surrounding vascular tissue. Nitric oxide is a potent vasodilator. It causes the smooth muscle of arterial walls to relax and expand outward, whitening the vessel and reducing blood flow resistance. This expansion directly counters the sluggishness and high pressure caused by the glucose load, facilitating smoother circulation. By walking, you trigger a physical response that helps shield the arterial lining from the stress and inflammation associated with a high sugar state. The effectiveness of this intervention depends on the postprandial kinetic window. To be effective, the movement must happen while the glucose is still flooding the bloodstream. On our timeline graph, the red area under the sedentary curve represents the total time arteries are exposed to high glucose levels. The immediate walk intercepts the spike before its peak, significantly reducing the duration and concentration of sugar the vascular system must endure. Waiting until the next morning to exercise misses this window. By then, the glucose spike has already subsided, leaving the vascular lining to bear the full burden of the high sugar state for hours. The timed walk achieves two goals at once. It uses a mechanical bypass to clear sugar from the blood, and it uses nitric oxide to reduce vascular strain. For those managing metabolic dysfunction, a brief, timed walk should be viewed not just as exercise, but as a precise physiological tool to manage blood chemistry in real time.
Thanks for watching Body Science School. Please like, share, and subscribe the channel for more.